Hi, I'm Dr. Joanna Robson. I'm a doctor of veterinary medicine and owner of Inspiritus Equine Incorporated. Welcome to recognizing the horse in pain and what you can do about it. Some of the most common signs of equine pain include bucking, biting when saddled, rearing, trouble with lead changes, having a very hollow or tight back, snaking of the head, refusals, and lack of engagement or refusal to move forward off the aids. A good place to start is to learn how to palpate or to feel your horse's spine. And we're looking for a dip, or there we have a twitch. Sydney here has an example of what we call a kissing spine lesion. When assessing the horse's back for pain, we must also consider the role of the rider. Proper rider positioning is essential to your horse's back health. Riders who are unaware of their own position or who have physiologic or anatomic problems will transmit those issues directly through their own seats into their horses' backs. One of the most important things to understand when we look at anatomy of saddle sitting is no two horses are alike. Every single horse is going to have a somewhat different shape to its back, different angle through the shoulders, different angle through the tree width across the shoulders. Pressure over this nerve causes a reflex whereby the horse will hollow out through the back, lift up through the head and the neck, flatten out through the croup. Measure the distance between those two lines. We have about a 5-finger range of motion through standing square and extension. I'll put some pressure on the pommel of my saddle as if I had a rider or some weight in the saddle. We'll take the flat of my opposite hand, insert at the top, and slide down. And we're going to look to see from the dust pattern created by that saddle if the saddle was shifting to the left, to the right, or actually twisting. In a sashaying horse, instead of tracking straight, he's actually circumducting. He's taking his legs swinging to the outside. So we want this horse to actually, as much as we can, through adjustment and body work, to track more straight, and then making a high velocity, low amplitude thrust. This causes a reflexive relaxation that actually causes the muscles to let go, the soft tissue to let go, and for Mother Nature to return that joint to where it should be normal. And stimulating those points releases neurotransmitters and endorphins. And from an Eastern medicine standpoint, in addition to those things, we also think again about our chi flow, which is our energy flow. Then when we add our other things like electricity or vitamin B12 to these points, we increase our stimulation over those acupuncture points. He's stretching out and relaxing. He's getting a very soft and sleepy look to his eye. Those are all classic signs of the release that we're looking for with our acupuncture treatment.